my homeopathic doctor or my naturopathic doctor, my chiropractor, my holistic healer told me this. I think most doctors do not enjoy contradicting other doctors or other people that you have confidence in, but there are times when you can't really avoid it. I'm not one to chop the legs out from underneath another doctor, and so people ask me all the time about alternative treatments. Acupuncture is a big thing. And look, there's enough people out there that have benefited from acupuncture that how could I say it's not a reasonable treatment? Sure, if you've run out of options, then as far as I'm concerned, absolutely try some of those other approaches. However, you have to use common sense. So I have two stories that I'm going to share with you. Briefly, years ago, I was working out in a gym and there was a fellow there, and from time to time we would end up spotting each other on the bench or something, and we never really made conversation. We were just literally kind of friendly in the gym. And one day I introduced myself, he introduced himself, and I said, "What do you do for a living?" And he said, "I'm a chiropractor." And I said, "Oh, wow." I said, "That's interesting." And he said, "What do you do for a living?" I told him I'm a podiatrist. And a match was made. We were very happy to talk to each other. And he said to me, "I would love you to work out of my office. Is there any chance I could get you in my office?" He's like, "I do terribly when it comes to feet. I never am able to bring people any kind of sustained relief with foot problems." And in my head, I was thinking, well, that's because you're a chiropractor. You should be doing back problems, right? Like, that's your specialty. And I know that chiropractors will tell you that many other things are affected by your spine. I'm not going to argue that or even discuss that. That's for a topic for a different day. At that time, I was working for someone. I asked my boss if I could go spend some time in that doctor's office. He told me I'd have him lined up out the door. If you come to my office, I'll have him lined up out the door for you. So she said to me, "You know what, why don't you try it a half day a week? See how that works out, and if it seems like you're generating some business, I'll let you expand it." So that's what I did. And I got there, and his office was kind of in the country, and I got there, and it was like in a sort of in a strip mall, but not your classic strip mall. They were like selling concert tickets or something, and I'm walking in and out of these people, "Excuse me, pardon me, excuse me." Finally, I make my way to the office, and I introduce myself to the receptionist, and she calls the doctor. He comes out and he greets me with a warm greeting, and I mean, just a really very affable character. And I go in and I said, "What's going on outside? There are so many people in that line." And he goes, "They're here to see you." I said, "Those are the patients?" And he's like, "Yeah, though, I told you I'd have them lined up out the door." I'm like, "It's lined up down the parking lot. You know I'm only here for 2.5 hours. And he said, "I know, better get to work." One of the patients I saw was an elderly woman, and I asked her how she was doing, how her health was, and she told me that she's doing much better now, but she just recovered from an infection in her heart. So I asked her what hospital she was in, and she told me I wasn't in the hospital. "What antibiotics were you taking? Are you still taking them?" "I never took antibiotics." And I said, "You had a bacterial endocarditis, and you weren't in the hospital, you didn't get antibiotics. What did you do?" "Dr. So-and-so treated me." And she was referring to the chiropractor whose office I was working out of that day. "He diagnosed you an endocarditis, and he treated you?" "Yes." "How did he treat you?" "He did some adjustments and manipulations, and thank God everything's working fine." Okay, so I'm very uncomfortable with that situation. You can imagine if you are a traditional doctor, that would make you very uncomfortable. So after this crazy day of seeing 1 billion patients in 2.5 hours, he and I had a few minutes to talk, and I asked him specifically about that patient. I said, "Did you diagnose her with an endocarditis?" And he said, "Yeah, it was a crazy thing." And I said, "How did you make that diagnosis?" "Physical exam." And I said, "How did you physically know that her heart was infected?" And he said, "It felt heavy." And as you're thinking right now, what felt heavy? I was thinking the same thing. And he said, "Her chest felt heavy." "Did you pick her up by her chest?" And he said, "No, her breast felt heavy." Okay, so trying not to be cynical, I said, "Had you ever felt her breast before?" "No." And I said, "Well, then how do you know it felt heavier than usual?" "No." He said, "It was warm, and yeah, I mean, she definitely had an infection." And I had asked her what her symptoms were, and she said, "I didn't have any symptoms. That was the miracle that he found it, because I could have been in really big trouble." "He had no symptoms, and you made this diagnosis?" "Yes." "And how'd you treat it?" "I made some adjustments." So by the time I got done with him, I recognized the fact there are two different types of chiropractors. There are those that truly believe that if your spinal column is in order, if it is intact, in alignment, then everything's going to function great. You won't get sick. You shouldn't get sick. You should not have any problems because your immune system will be ready to fight off the Chinese army. And then there are those that believe that if you have neck pain or back pain, they can help you. Maybe hip pain also, anything that's along the core. I'm much more comfortable with that approach. Second story. I had a patient who came in with bunions, bad bunions. Literally, she couldn't fit them in her shoes. She had to cut like a little hole for her bunions on the inside of both of her shoes, on all her shoes, because there was no way to fit them in her shoes. She told me she didn't want to go to a foot doctor because her holistic healer had told her that all they're going to do is surgery and you're going to regret it for the rest of your life. I said, so what was the treatment he recommended? And she said, I'm not going to tell you. And I said, you're not going to tell me? That's right. Why not? Because you're going to laugh at me. I said, you're worried I'm going to laugh at you? So she said to me, I'll tell you only if you promise not to laugh. And so then she told me that he had her soaking her bunions in her own urine 3 times a day. Now, I didn't laugh. I almost gagged, but I was thinking, my first thought was, how exactly do you do that? And that came off my tongue. She said, what do you mean? I'm like, were you peeing in a basin and saving that and adding to it later in the day, and every time you had to go, you would just add to that so you were freshening it up all the time? Or you could only do it when you had to go to the bathroom, and like, were you doing it in the toilet? How were you soaking your foot in that? And she wouldn't tell me the answer to that question. But she did tell me that it didn't do a darn thing for her bunions. Surprise. Your holistic healer, your naturopathic doctor, your chiropractor might be able to make it sound reasonable that it's a natural substance from within your body, and I don't know what else they would say, but they could say things that might make you think maybe it could work. It won't. Do not soak your body parts in urine, and do not soak your body parts in feces or blood or anything else that's like that. Do not do it. Get another opinion before you try it. That is my opinion on other types of doctors. So I hope you'll take those words seriously and understand that even though today, the boundaries of what's medicine and what's not medicine have been expanded and pushed, and my feeling is you have to maintain a middle-of-the-road common sense. And if you don't, you'll find yourself soaking your feet in urine before you know it.